Good, everyone. We are delighted to have you on the phone this morning. We're still hearing quite a few beeps as folks join, so we're just going to get maybe another minute. We're not hearing too many beeps as we get started, but we will get started very shortly. Right, good morning again, everyone. We are so glad to have you on the line with us this morning to kick off the first steps of our LMCH needs assessment process. I hope everyone had a very happy holiday and happy new year to you all. I'm going to let you know first who's in the room with me this morning. I have Trudy Esch, Carrie Terry, and Robin Osborne from MDHHS here with me today. And I also have Lauren Lepine and Erin Madden from MPHI in the room. And we're all here to support you through this process, answer any questions that you have, make sure that this process works for all of us. So we will have plenty of time, I believe, at the end of our time together for questions. So as you have questions as we go, please make note of them, and we'll make sure we get to questions toward the end of our time together. Just a reminder, we have all the phones on mute on our end. We are not entirely sure if you're a call-in user, if the mute on our end works. So if you could also mute your phone on your end, just as a safety precaution, that would be wonderful. Also, please remember not to put your phone on hold while we're on the call, because that sometimes allows us to hear the music that you have on your end, which is lovely but can be slightly distracting. With those reminders, let's get started with sharing our agenda for today. So we'll begin with an overview of the needs assessment process, primarily because there might be some of you who weren't on our first webinar. That webinar is now posted on our SharePoint site, which we'll share a little bit more information about later, so you can access that and view it at another time, but we didn't want you to feel lost today, so we have just a few key things from that first webinar that we'll go over this morning. The majority of our time will be spent talking more specifically on what steps 1 through 3 will look like in our needs assessment tool. You'll receive the tool itself, the first 3 steps of the tool, after the webinar today, so that you can jump right in and get started on that effort, and we'll be referencing that document as we talk this morning. We'll be talking about organizing for success, engaging community partners, and visioning. I'm also going to talk about some example resources that you can use as you get started on these first 3 steps. We'll talk a little bit about the SharePoint site that's set up to host the webinars that we complete, as well as any supplemental materials and documents that are provided either by us or by your fellow health departments who have lots and lots of great experience and examples going through these similar processes in assessing community needs. We'll talk then about next steps, and I believe have plenty of time for questions. All right, so jumping right into our kind of overview of the process. As a reminder, we have designed this as kind of an 8-step process, and we're going to go through the steps sort of one chunk at a time. We'll talk about what one step will look like, and then we'll move on to the next step, talk about what that step will look like, and so forth, with the idea that breaking this process up into pieces can be a lot more manageable than trying to think about how are we going to take on this whole process at once. So the first part of this process involves organizing for success, engaging community partners, and visioning. That's the focus for today. After that, we'll be talking about 3 types of assessments that you'll be completing, and we'll break those assessments up so that we're talking about them one at a time and completing them one at a time. We'll talk about interpreting assessment data. Then we will move on to using the data to identify strategic issues within your community, developing goals and objectives, and developing strategies and action plans. From our first webinar, we have some ideas about what's most critical to keep in mind as you engage in this process. We think that for this needs assessment to be maximally meaningful and impactful, that you'll have to have partners engaged in the process, and especially partners that are most impacted by the forces creating health inequalities and inequities. We talk most especially about what this looks like today, provide some pointers and ideas, and we're here throughout the next month or 2 to provide technical assistance on this piece of the process in particular. I also think it's critical that multiple types of data are used to identify both strengths and needs, that the process be completed without predetermined outcomes. Evidence is being used to select priorities and select objective targets. And we also believe it's critical that strategies for improvement are grounded in evidence-based public health practice. And we'll highlight how to turn that into practice in future webinars as we get further along the process. So talked about having an engaged set of partners as being critical to having an impactful, meaningful needs assessment. And when we say that, when we talk about that, one of the key piece of that we're thinking about is the public health system as a whole. And I'm sure many of you are familiar with this, what's commonly called the egg diagram for the public health system. The way to think about this is that this is the system of partners that are influential in the public's health. So if we don't understand health status within our communities, we have to think about that in the context of what multiple players are contributing to health, to wellness, to health equity, all of those types of things. So a key role in health, for example, it's difficult to understand the health status of children who are school age without understanding what's going on in schools and understanding schools as a critical partner in producing health. Our food system is critical in understanding the health status within our communities. Our transportation systems, all of those are key players in contributing to public's health and understanding the health outcomes and health behaviors that we're interested in. So this idea of the public health system and public health system partners is something that we'll be referring to a lot today. And when we're saying that, this is really the concept that we're thinking about, that network of organizations and sectors within a community that has an influence ultimately on health behaviors and health outcomes. The reason that we think it's important to engage all of these partners in needs assessment process really is grounded in our understanding of health from a life course perspective. So we talked last time about the phases of life course that you see on this next slide. And we know that we have in communities across the state really strong groups of partners that are focused on particular parts maybe of the life course. So really strong partners that are thinking about early childhood, or really strong groups of partners that are thinking about the infancy stages of the life course. Or adolescence. Groups really focused on understanding the well-being of adolescents. We don't necessarily always have groups that are kind of thinking about health from that life course perspective, that are thinking about health from the time point before a baby is born all the way through adulthood. And in this process, that's what we're going to ask you to think about. What parts do you need to have around the table to make sure that you are understanding health across the life course, which might mean bringing different groups together. It might mean including new partners in existing groups. The other piece of this that we think about is informing why we want to bring together public health system partners is that we think of health outcomes as resting on kind of a broad set of circumstances and systems within communities. So we can't understand health outcomes if we don't understand health behaviors. And, we're kind of really comfortable working in that space. We understand that if we want to reduce cardiovascular disease, we really have to think about smoking, to think about physical activity, we have to think about nutrition. I don't think about those things. It's really hard to have an impact on reducing cardiovascular disease at the population health level. But also know that health behaviors rest on what's going on within a community. It rests on understanding social determinants. So if we're worried about cardiovascular disease and we're worried about smoking and physical activity and nutrition, we have to think about our food systems, our transportation systems, the walkability within communities, that kind of thing, that kind of realm of social determinants. We also have to think about what's going on within our communities around the direct enabling services that support and promote health at the community level. We include public and private sector organizations that address sickness and wellness, as well as the services like the focused on clinical linkages that help make sure that people can access the care that they need and that they're linked to services that are maybe outside of the healthcare system. We know that if we want to understand health behaviors, we have to think about these pieces as well at the community level. And we know that what a community can accomplish rests on a broader set of system forces and factors that influence what those social determinants and direct enabling services can do. We know that assessment and planning are critical. Convening partners is critical. Thinking policy and enforcement, having strong surveillance systems for use data for improvement, all of those things have an influence on direct and enabling services, as well as shifting social determinants of health such that they are more likely to produce positive health outcomes. So when we think about health outcomes from this, kind of ginormous perspective of, everything influences health, it kind of helps encourage us to think about who should be at our table when we're talking about maternal child health in a broader and more comprehensive way, which I know lots of communities in Michigan are doing amazing work around this, around convening partners outside of who's traditionally been involved in conversations about health. And we encourage you to bring that thinking to this process as well. Another thing that we are going to ask you to keep in mind, having said that, is that we definitely want you to build from what you have in place already within your communities. We want you to think about how this links with your CHA-CHIP or CHNA. You've been working on your community, the community health assessment and health improvement plan that maybe you're working on for FAB, or the community health needs assessment maybe you've worked on with your nonprofit hospitals in your communities. Other assessment activities that you might have engaged in. This can link very nicely with those existing processes potentially within your community, if that makes sense to you. We also want to remind you, as we said on the first webinar, if a step has already been completed, you don't have to do it again. If you already have a strong engaged group of partners around maternal child health in your community, we are definitely not asking you to form a new group to do this particular project. We're asking you to think about how this can connect with that group's existing mission and set of activities. We also want you to keep in mind that if this is something that's fairly new for your community, for your health department, that's totally fine as well. And we don't expect you to, in a month, convene 50 partners and start organizing meetings amongst them. We're going to encourage you to take on one step at a time. Think about what's manageable for you based on where you are, who are your most critical players and partners in your community, and bring them to the table and start the conversation from there. We're just asking you to start with what you have and take what is a reasonable and realistic step forward for you. All right, I'm going to jump right into step one, which is for success. So there's a couple things that you'll accomplish through this part of the assessment process. You will articulate your goals for the assessment. So clearly one of your goals is meeting the funding requirement, but we're hopeful to have other goals in mind as well, things that you want to achieve for your community and with your partners that you can kind of think about as guiding this process for you, for engaging in it. Through this piece of the process, you'll also identify if you have an existing group of partners in your community that you can build off of for this work. We'll ask you to identify a leadership team, which will just be a couple folks from health department, maybe someone external, but certainly from your health department, that will be able to make decisions, move the process forward, coordinate the activities that are involved. We'll also ask you to think about how community members most impacted by the root causes of health inequity will be authentically involved in the process. We'll have to develop a timeline and think about barriers and strengths. So just into this piece a little bit more detail, when you see the tool, you'll note that this piece of the tool begins with asking you to respond to a couple of questions. And this should be something that you can complete within a small group at your health department as just like the first piece of kicking off this process for your team. So answer these following questions for yourself and for your health department. What are your agency's overarching goals as you complete this maternal child health needs assessment process? So you have goals like we want to engage some partners that haven't been at the table in the past, or you might have a goal like we want to better understand what's going on with in the middle childhood phase of the life course that we really haven't thought about or jumped into much. We have goals like we think how to better transition from assessment into having concrete plans in place for our community to move forward on what we learn. Might have a goal around better understanding what you can get out of vital records. It could be a whole variety of things. So we just want you to have a conversation about what can we get out of this process that's important to us as a health department that'll move forward our maternal and child health work. The second question that you'll be asked to respond to is, does your community have a broad group of MCH system partners who will engage in the needs assessment? So in this piece, you'll describe to us either, yes, we have a group of partners that's really been focused on child health, and we think that we can add a couple other key players and get a group together that makes sense for us. Or you might say, yes, we have this broad set of MCH system partners at the table. This is what that group's called. They are going to be our group for this process. Or you might say, no, we're starting from scratch. So it's really just kind of telling us, what are you starting from? The third question will be, who will be part of the small leadership team who will make decisions and coordinate the assessment. So here we want you to think about a couple things. We want you to think about who can help you make decisions to move the process forward. And we want you to think about who's going to do sort of the coordination and communication that the process will involve. Who's going to send out invitations to folks to hold meetings, who's going to make sure that there's space for meetings, who's going to document conversations as they're happening, that sort of thing. To answer this fourth question, how will community members most impacted by the root causes of health inequity be involved in this assessment process? And, you know, that's a big question. It can be a big question to answer. And we want you to answer it in a way that's really authentic to where you are in engaging community partners in conversations at your health departments. Some of you have lots of authentic community engagement going on. You have families involved, you have teens involved, you have all kinds of groups that are involved in informing your programs and services, helping you understand data, all of that. Some of you might be at a different place with engaging community members in an authentic way. So I just have, you know, just a couple things to keep in mind as you move forward in engaging community members in this process. But I also have, you know, this is a big topic, not one that can really be covered adequately on one slide. So I have a resource linked below that I provide some nice, clear guidance on community engagement that comes from a public health perspective. It's a CDC document and really does a nice job talking about what authentic community engagement means and looks like, and it kind of places different strategies for engagement on a spectrum, which I think is a helpful way of looking at it. But some of the things that we'd encourage you to keep in mind that are sort of part and parcel of authentic and community engagement. You know, sometimes we engage community members because it's sort of an expectation or a requirement, which can lead to kind of overlooking the values that community members are bringing to the process. So we'd really encourage you to think about what is it that you are engaging community members for? What expertise are you looking for them to bring? What voice are you asking them to bring to the table? Community members have substantive expertise on the community in which they live, work, and play, and from a sort of broad level, that's always the expertise that they're bringing. And, you know, from a more specific and concrete perspective, we want you to kind of think about up front, what are you asking them to bring to the table, to bring to these conversations? We would encourage you to communicate openly, regularly, and through multiple modes. A lot of us are super comfortable communicating over email, for example, but might not be the way that your community partners are regularly communicating. So just thinking about how can you reach your community partners in a way that is where it be effective in accessing them. We encourage you to also think about the different ways that potentials are created between professionals and community members who are coming to the table set by a professional. One example of this is, I do all the time, is talking in acronyms. We're all kind of comfortable talking in our acronyms, but using jargon, using terms that are unfamiliar, and that excludes people from the conversation who don't know those acronyms. So just simple things like that, kind of thinking about what are the things that make it so that my voice is louder than your voice, and how can I try to minimize that within the conversations that we're having. I've had the pleasure of working with health departments and seeing this happen so beautifully with health departments and staff at health departments, bringing humility and respect to the interactions they have with community members, recognizing the strengths and assets and competencies that they're bringing to conversations and to the work they're doing together in really important and meaningful ways. I included this here because I always think about, I attended this presentation and the presenter was taught how sometimes when organizations engage community partners or bring community members to the table, they do so from much a deficit perspective. And, you know, he brought up the question of, you know, how would you feel if every time you came to a table, people were thinking about who you are on your worst day? And I think about, oh, geez, you know, I would hate for someone to give me as a parent from, you know, the moment that I was yelling at my daughter this morning because she's not getting ready quick enough. You know, to me, it was a powerful sort of statement, and I like to try to share that when I can because I think that brings a very personal light to this idea of making sure that we're treating people based on what their strengths and assets are, first and foremost. We'd also encourage you to find ways to support and compensate participation. Of course, as professionals, when we are attending a meeting like we are all today, we're being compensated for that as part of our job. And when it's possible, when you can think of ways to do it and find creative solutions for compensating community members, either through a stipend or through paying for travel in some way, paying for childcare, that's a really substantive way to encourage authentic engagement. I'd also encourage you to think about scheduling that takes into account when community members would be available to meet and locations that are accessible to community members, which in many communities is the health department. It can be the health department. Sometimes it's not. So, you know, keeping that in mind as you think about engaging community partners. I also encourage you to take some time to prepare any community partners for being at the table, making sure that you're being clear about the role that they're playing, the importance of their voice, helping make sure that you talk through the agenda with them, answer any questions that they have about the meeting or what they're being asked to contribute is an important way to make sure that they're ready to be at that table. As other professionals are that are familiar with what that conversation will look like and what an agenda for a meeting like this would include. So those are just a couple ideas for authentic and community engagement. But again, I really encourage you to dive more in if you're interested to the document that I linked below to learn a little bit more about what authentic community engagement can look like. Okay, so another piece of this first step is organizing for success. What we have in the tool when you see it is a timeline that's filled out with various steps in the process. It's on our next slide, which is delayed slightly here. I talked too long. Yes, I should say, after having said all of that about community engagement, that what we'd like you to respond to in the tool is just what are your thoughts about how you're going to engage community members in an authentic way? How do you think you might reach out to them? How do you think you might make their participation most meaningful? So we're imagining a paragraph written about that, something of that nature, just to document your conversation and your ideas. And a little bit of a technical difficulty on the webinar. Maybe take it after people are still there. It looks like people are there.
Yeah. We can ask people who've already done what they've done.
Hey, everyone is unmuted at this point. We just want to make sure that we're functional here. Can you still see the slides?
Yeah.
So you're seeing that they are stuck. Okay, we will troubleshoot that on our end. But while we're doing that, is there anyone out there who has completed this step, any pieces of it that you can kind of share a little bit about your experience? For example, what steps have you taken to make sure that community partners can be authentically engaged in the process? Still, it's a good question. So we're going to pause for a second to see if anyone is willing to share your strategies for authentic engagement. I'm seeing speaking there.
One way that we're doing kind of authentication is by involving our advisory committee from CSHCS. So then we have parents that are involved and can provide some feedback.
So Special Healthcare Services has great systems and structures in place for family engagement, and that's a great resource to reach out to. Thank you for sharing that. What concepts you might want to share?
With our local McV home group, there's a local leadership group, and there are parents who are actively participating in that group, and we've used some social media opportunities to engage with parents. And also our regional perinatal group now has a parent representative, so the Great Start collaboratives and all of those other initiatives. So I think there are in our various communities many different ways to tap into parents who may be actively participating.
Thank you for that list of really great sort of groups that are doing parent engagement within your communities.
We have teen advisory groups that are working with our school health clinic areas, and so I think that they're a group that we will be tapping into as it relates to this assessment.
That's another idea. Okay, we have noticed a decline in one of our collaborative meetings. In response, we've sent emails asking for suggested new dates and times, as well as explored meeting times and locations that piggyback on other community meetings with similar attendees, looking to maximize travel and efficiency of time. That's a really smart strategy as well, with all the things that are going on in communities, figuring out what you can connect to that already exists, where the folks that you want to reach are already there. That's really smart. Thank you for sharing. I think that we will jump on. Oh, we have another comment as well. We also have taken time at our collaborative meeting to review each other's strategic plans in hopes of alignment. Oops, our screen went blank. And maximizing resources, another really good way of connecting with other groups and making sure that all of your work is heading in the same direction. We're going to talk a little bit now about the timeline, and we're going to mute everyone again just so we're reducing the background noise as much as possible. The next piece of this first step is setting up a timeline for yourself. So when you receive the tool, you'll receive this draft timeline that you can modify. You can add additional steps to it if you like. You can provide more detail within it if you'd like to. What we would like you to really encourage you to do is put specific dates for yourself where you see X's within the example timeline, so that you have really concrete goals as to when you're going to achieve each piece of this process. Can't see the steps really clearly probably through the webinar, but when you see the tool, you'll see kind of how it's broken out, and you'll see if you'll want to add any more detail to it. We have circled in red, we have already completed this step. So if there's any piece of this process that you already have done, you feel like you're in really good shape with it, then put it in that box and we'll know to access that information from you in a different way. We'll ask you to send us kind of documentation that tells us how you did it and what you found and that kind of thing. So you might already have a vision statement, for example, and we just ask you to send that to us and share with us what it is. The list of this first step is talking about strengths and barriers of this process for you and for your organization. So there's two questions. What are the strengths you and your partners bring to this assessment process? How might they be used to strengthen this assessment? And then barriers. What are the potential barriers to a successful assessment process, and how might they be overcome? And on the next slide, you can see specifically what you'll be asked to fill in as far as strengths and barriers. There will be a table in the document that's fillable, so just click an box and write what you talk about as far as your strengths and your barriers. So examples of strengths might be things like, we have a community partner that has a great space for community meetings, or we have an existing group that we think we can pull focus group participants from, or already completed really comprehensive analysis of health in the perinatal period that we're going to be able to pull from and learn from, things like that. That are resources, strengths that you can bring to this process. And we'll ask you to talk about ways that they can be used. So if you have an existing group where you can pull focus group participants, you can say, you know, we know that we don't have as strong data about this particular topic or this particular group as we like, and we think that we can learn a lot through talking with teens about their experience in their social interactions with their friends, and we think that that's really key to understanding some phenomenon we're seeing in our community around mental health with young children, that kind of thing. It doesn't even have to be that long. It can just be a very brief bullet point type of statement about why your strengths are strengths, basically, and how you can use them. So same thing with barriers. You can identify things like time, staff availability, data availability, which are super common barriers to being able to incorporate a process like this into your existing incredibly busy and overstressed work lives. So I want you to have conversations about those up front and think a little bit about ways they can be addressed. So if you're thinking one of your barriers is that you don't have an existing group within your community and you're going to kind of be starting from scratch and putting one together, what we addressed is by thinking about scale, that we're going to start with a small group of maybe 6 or 7 people as our first try through this, and we're going to build from there. So I just want you to think about how you're going to make each barrier manageable and how you're going to make each of your strengths work for you to its best potential. Summary with step 1, what you're doing is internally to your health department, answering a couple of key questions, thinking through what this assessment is going to look like for you. We want, again, you to build on what you have. We want you to make it manageable, and we want you to spend some time right up front thinking about that in a concrete and specific way. That's kind of the point of this first piece of this process. transition to step 2, which is engaging community partners and builds right on the conversations that you're having in step 1. So in a piece of the process, you will identify participants or build from an existing group, as we've talked about. We're going to encourage you to include both traditional and non-traditional partners. I want you to identify individuals who are impacted by the root causes of health inequity and put in place strategies that will support authentic engagement in the process. And so, again, that builds on the thinking and planning that you do in the first step. Then, finally, we'll be asking you to invite participation in the process. So actually sending out send flyers, calling people, talking with groups about what this process will look like, that kind of thing. And we have some resources to support that. So as far as what you'll actually do in the tool itself, you'll fill out a table that lists potential partners, potential sectors, community that have an influence on health that could be engaged in this process. Of course, we encourage you to think about this as comprehensively as you can, but the you can part of it is really important. If including partners from all of these sectors, and this is part of the table, this is not the list. The table is longer than this, and we'll see that on the next page. Maybe flip to that. This is the list of the sectors that are included within the table. And if it is not feasible to include everybody at this point in time, that's okay. Again, we want you to do what's realistic. So you can flip back. So we want to include a broad range of perspectives, as broad as you can. We want you to represent a variety of groups, sectors, and activities within the community. So again, thinking about all of those things that influence health outcomes for moms and babies and families and teens, we want you to think about that in a really broad way. And we also want you to think about who can bring the necessary resources and enthusiasm to the table. Engagement, I think of as kind of a long-term goal and a long-term process. If you have someone who does time and space to do this right now, that's okay. And that can be a goal for the future of, how do we better engage the YMCA in this process in the future if they're not game for today? How can we better engage our hospital partners? If today they don't have time, how can we work with them to make sure that in the future at some point they can come to this table with us? That's a normal, I think, expected part of engagement is that it ebbs and flows and takes time and sort of a long-term vision of who to bring to the table. So the partners on the next slide that you've kind of previewed includes a wide variety could include a wide variety of organizations, public, nonprofit, government organizations. There are people within communities that have connections with multiple sectors. If you have folks like that, you can think about who are our key players within our community in maternal child health that maybe have a strong connection with these community and neighborhood organizations. So not necessarily the case that you have to have a discrete name in every single one of these boxes. Again, it should be realistic and it should be reflective of how your community looks and how it operates. In this set of tool, after you fill out that table listing who you're going to have involved in the process, you'll answer a couple questions. You'll tell us about if you've identified families to engage as a partner in the process, and you'll tell us how you'll ensure that participation is meaningful and supported. And if you are not engaging families in the process, we'd like you to tell us why you won't be doing that at this time. And we're happy to provide support in thinking through the how and why of family engagement, if that's something that's feels more challenging at this point, although I know a lot of you and a lot of public health programs are already doing this really successfully and meaningfully. We'll ask you to talk about any gaps in identified partners that you have within kind of the table that you filled out above. We want to tell us about those gaps. So if you haven't engaged, anyone from, oh geez, I'm trying to think of sectors right now. If you haven't engaged anyone from transportation, for example, tell us why that's a gap for you within your community, why you haven't been able to do that, maybe they don't have time and space, maybe it's that you don't have a good relationship and connection with them. It could be a wide variety of things, but we'd just like you to tell us why. I'd like you to talk about your process for inviting partners and families to be involved in this assessment. We want you to tell us how you invited them, how you recruited folks to be involved. If you are thinking about answering these questions, engaging community partners, and you're thinking about building off of an existing group, we need to think about if key partners are missing from existing groups that you have in place. And we want you to think about why those other partners aren't at the table. So if you have a group that's focused on a particular phase of the life course, I think that this is really common in communities where you have a group that's very focused on adolescence, or you have a group that's very focused on moms and babies. Don't necessarily talk across the maternal child health life course. That might be the reason that they aren't at the table, that this group has been focused on this phase of the life course, and we're going to build on it to make sure we're covering all the phases of the life course. You also have key players that are missing for other reasons that you could share. We want you to consider if they could offer an important perspective as you're assessing maternal child health. We want you to think about if you have missing partners, missing players could be included in this particular process. What strategies might you use? How could you expand your group of partners for this purpose? If you are in a situation where you're starting from scratch, you don't have an existing group in place that you can build off of, we want to think about who are the most critical stakeholders in the process. And we'd like you to think of who has access to data. We want you to think about who has good connections and relationships with community members who are most impacted by the causes of health inequity. We want you to think about who has access to programs and services for the maternal child health population. And we want you to think about who has the power to make a change based on identified priorities. One of the key aspects, I believe, of a meaningful needs assessment process is to begin with the partners involved, with the partners who you like to be involved in ultimately making change based on the results of the process. We're all more committed to results if we had a voice in doing that interpretation and making those decisions up front. So that's where you want to end as you think about where you're beginning. And of course, we also want you to think about what size of a group can you realistically manage right now. Engaging community partners, there's, of course, lots of ways to do this. We have a couple resources to share with you. And just to provide you with a starting point, these resources can be modified in any way that you see fit. You can, of course, invite folks through personal contact, and we put together a brief elevator speech that you can use to kind of provide an overview of what the needs assessment process is and what they'll be invited to be a part of, what they'll be asked to do. We also put together, if you want to contact folks through mail or email or through handing out flyers at an event or that sort of thing, we put together a kind of formal letter of invitation as well as a less formal one-page flyer that, again, you can modify to meet your needs and to articulate this in the way that's comfortable to you, but just to provide a starting point. These documents will be posted on the SharePoint site, and they're just Word documents that you can easily go into and type what you need to type and, replace language and put in the name of your health department in particular. That's an important one. You wouldn't want to use these as is because there's kind of placeholders for your health department's name or for your group's name that you want to reference within the document. As you are communicating what this process will look like with your community partners, the folks that you're inviting to participate, as much as you can at this point in time, it's important to be clear about what you're asking community partners to do. And this slide provides kind of an overview of ways that folks would be involved and gives them an idea of the time commitment of being involved. So the next piece of this is visioning. That's the first piece that your broad group of community partners would be involved with. Visioning is something that would happen in one meeting, so they'd be participating in a meeting for maybe an hour or an hour and a half to talk about your vision for MCH within your community. The other next way you'd community partners to be engaged is to help you interpret assessment data. And this could, depending on the volume of data that you're working with and the way you'd like to approach this, could happen in 1 meeting or 3 meetings. It also depends on which assessment data your community partners want to contribute to interpreting. So you could invite someone who is most interested in the maternal child health system assessment and will be involved in interpreting results from that meeting, but won't participate in interpreting results from the other two, for example. And that they'll be involved is participating in a conversation about MCH infrastructure and capacity. So that's the maternal child health system assessment. Probably everyone in this group would be invited to participate in actually completing that assessment, providing the data for that assessment. This group would be the group that identifies themes and strategic issues. So they'll look at all the data as a whole and how you interpreted it and decide, big picture, what is all this telling us? What does it mean? Which would take place in another meeting that would probably be about a 2-hour meeting. They'll be involved in identifying priorities, and this could involve a conversation in person. It could also be done through an online survey if your partners don't have kind of the time and space to come together again. They would be invited to develop goals and objectives as well as action plans. And the action planning meetings will, the number of those will really depend on the number of priority goals that you come up with. So this just gives kind of an overview sense of what you'd be asking people to do, which is basically participate in a series of meetings over the next several months to get their ideas, their insight, their expertise, and their perspective. Okay. Step 3 is visioning. We want to start out today by sharing the Title V vision statement. So Title V in their revision of what this grant funding, this block grant funding looks like, developed a vision statement that you can see on the slide. Title V envisions a nation where all mothers, children, and youth, including children with special health care needs and their families, are healthy and thriving. And so this is the kind of statement that we're hoping that you'll be able to come up with in collaboration with your partners and in your community. I think that with vision statements, it can be challenging to kind of get them started and to commit to that process of coming up with a vision statement. When I first started kind of doing facilitation and planning, I was kind of a visioning critic. Of, you know, this kind of statement, sometimes I think we take for granted that we're all headed in this direction, that we all believe that this is where we're going. So why should we spend time coming up with those words when we kind of already know this to begin with? And what I learned through engaging in visioning processes is that statement is nearly as important as bringing everyone together around a table to have the conversation that leads to the statement. Have that conversation about what do we see for moms and babies and children with special health care needs and adolescents. What do we want this community to be like for them? What do we want our systems to look like? What does optimal health look like and feel like for members of our community? Those conversations, starting a process off with a conversation like that, can bring everyone to a point where they are feeling like a team, even though they're not coming from necessarily the same sector or perspective. If you start with talking about what you want to accomplish in the end, it provides you a touch point throughout the process when things get more challenging, when competition comes up or where challenges around resources come up. Had that conversation about where you're all headed and having that touch point can be really powerful for a group and stay together and sticking with it are the things that are harder about processes like this. We have some suggestions for coming up with a vision for your community that we'll go through. And we also have a really nice example from one of your fellow health departments that we'll talk through as well. So within the tool itself, the visioning section includes a table with a couple of questions where we'll enter some text about what you heard in conversations you had in response to questions like these. So you can modify these questions. You have to ask these questions specifically. You can can tweak them so that they make sense to your community. These are kind of a starting point, some ideas for how to talk about vision. So imagine yourself in this community in 10 years in the future. If we're successful, how will our community support health across the life course? What are the important characteristics of a community that supports health across the life course? 10 years from now, what would we want a local newspaper to say about our maternal and child health in our community? So just kind of prompts to get a discussion started around vision. So a couple of examples or options for visioning we wanted to provide you today, and we're not suggesting you use all of these. We're suggesting that you choose one, modify it based on your needs, use a different process if there's something else that you're comfortable with, but we just want to give you a sense of how you might approach a visioning process. This first one is really simple and quite quick. When we've used it, we've gotten through this in a pretty rapid manner, and it kind of accesses that creative part of some people's minds. That I don't have, that's why I state it that way. This is a very challenging exercise for someone like me, but for some people, they come up with great ideas. So in this process, what you would do is ask each person to take 5 minutes to respond to the following scenario. Imagine this community 10 years in the future. On the front page of the local newspaper is a story about maternal and child health. What is the headline? So this is a positive vision of the future that the group is articulating in a series of newspaper headlines. After they write down their ideas on an index card, you just go around the room and ask folks to share the headline that they wrote. As a facilitator, what you would want to do is comment on what are the common themes that you're hearing in headlines, what are some of those common ideas that lots of folks are reflecting in the headline that they write. At the end of the meeting, you would collect all of the index cards that people shared and use the words and ideas that are on those cards to come up with a vision statement. So you wouldn't actually write the vision in the context of the meeting. You could, but that can be a longer process. Really up to kind of you and the spirit of your group and as to how you would want to do that. When we've done this, we've taken the cards and drafted a statement outside of the meeting and then shared that draft back with the group to get ideas on maybe other words that could be used or sort of their take on, does this reflect the character of our conversation? An option is the target. When we've done this, we have, we're going to actually do this one electronically today, which is not what we've ever done. We've been low-tech when we've done this in reality. So what we've done is we've drawn a target on a really big piece of paper and stuck it to the wall. And we've asked the group to respond to a couple questions. And you could modify these in any way that you see fit, but we ask questions like, imagine yourself in this community 10 years in the future. If we're successful, how will our community support health across the life course? And if you feel like there's prompts that are needed, if folks seem confused by that question, what does our community look like? What are you hearing in that community? What do you feel when you're in that community? That sort of thing. The way we usually do that is we give folks a chance to think about their answers to that question silently, independently, and alone. There's always people in groups who have an easier time responding if they've had a chance to reflect and think first. We want to give those folks time to do that good independent work. If we have a really large group, what we'll do is ask people to kind of share their words, their ideas with one another in groups of 2, 3, 4, something like that. Identify kind of for them what are the things that they heard amongst other the ideas in their group that really stick out to them as these are important, these are things that are really part of our idea about what we want our community to be. And we have groups kind of elevate theirs to the larger group conversation. If it's a smaller group, if it's a group of maybe 8 to 10 people, then we would go right to sort of everyone sharing the ideas that they wrote down through that silent work that they did on their own. As people share the words and short phrases that they hear, what we do is write them in the target. And then we use those words and phrases to form a vision statement. And again, share that draft over email so everyone has a chance to review it on their own and provide comment on their own. I think that in a process like this, it's really nice to kind of think about folks' different levels of comfort communicating within a large group. Some people have no hesitation at all, of course, and some people would much rather to one other person or a couple other people, or just communicate their ideas in writing. So you want to think about how can we make sure we're really hearing from everybody, even those that are not as comfortable speaking up in a large group situation. So to kind of illustrate how this process will work, we're going to, I've never done this over the phone before via webinar, so this will be a new challenge. But what we're going to do over phone today is go through this exercise that I just shared. So I'd like everyone to take 2 minutes, again, silently, independently, and alone, to reflect on your answer to the following question. Imagine yourself in this community 10 years in the future. So you can think of the community as the state of Michigan. Imagine yourself in the state of Michigan 10 years in the future. If we're successful with our work in maternal health, how will Michigan support health across the life course? What does Michigan look like? What does it feel like to live here? What are the kinds of things that you hear within our state that support maternal and child health? And take a few minutes to jot down your ideas on your own in response to that question of imagine yourself in this community 10 years in the future. If we're successful, how will our community support health across the life course? I'm going to hear and everyone think for just a minute. Okay, part where the facilitator feels really nervous. What I'd like to hear some of the ideas that you come up with. If we were doing this again in a group of this size, we would have people talk in small groups where they talked in the large group so that they could feel most comfortable sharing their perspectives with a group of this size. But since we don't have small chat rooms set up, we won't be doing that today. But you have, I'd love to hear some of the ideas you've come up with about what you'd like our state to look like 10 years into the future. And we're going to record those in the target that we've drawn. And you can write your ideas in the chat box. You're unmuted now, so you can just speak over the phone and we'll capture your ideas.
Okay, great. You want to all just talk into the phone? I mean.
Yeah, whoever is willing to jump in and go first, that would be awesome. Thank you.
All right, Mike Presick here. I'll get us started.
Thanks, Mike.
Let's say Michigan, where we had a properly vaccinated population, where we had no environmental concerns, particularly from contamination like lead-3, where our families had access to good health care, where we had birth outcomes, substance abuse or mental health issues, and we had with that were practicing healthy nutrition and appropriate exercise.
Fantastic ideas. Thank you, Mike. As we're typing those up on the screen, do you see anything that doesn't reflect what you want to contribute?
And mental spelled wrong, but you get the idea.
Thank you.
It's always harder when people can see you.
That's just a start, I mean, but anyway.
you for those ideas. Is there anyone else who's willing to jump in? I see a comment, healthcare is prevention focused. Lauren, a second to catch up.
Okay.
Healthcare is prevention focused. What
I'd like to.
Go ahead.
From Detroit. I actually had the only differences I had in my state was to provide clinical and social services in an equitable manner across the life course for pregnant teens and communities.
In an equitable manner?
Thanks.
That's one. Thank you for that contribution. We're learning how to do this on this.
I would like to see health and all policies so that it was incorporated into workplaces and, you know, there would be opportunities to have meetings where people walked or, you know, to have healthy nutrition snacks. You know, health was the first option.
Thank you. I also see in the chat where people are more receptive and aware of their resources available, also less infant deaths due to unsafe sleep habits. So receptive, aware of resources. Safely. And I see limited barriers to receiving care regarding mental health, substance abuse, dental, medical, versus affordable and available. So barriers to care, affordable, available resources. Yeah. I'm sure there's a million other ideas out there. Would anyone else like to contribute to our target here? Preconception health. Put sleep, but we can put fewer infant deaths also. Yeah. Okay.
Fewer maternal and infant deaths.
Maternal and infant deaths.
Just blocked you out.
Okay, you kind of get a sense of how this works, of that idea that you ask everyone to kind of reflect and think about what they are envisioning for the future of their community, and ask them to just contribute ideas and write them down in the circle. The challenge after this process is thinking about how to sort through all of the ideas that people contribute and put them together in sort of summarized ways. So sometimes you might see kind of a theme around having environments that facilitate and support health. I think we see that a little bit with this piece of it. You might see a theme around access to really high quality services that people are really interested in receiving and are knowledgeable about. You might see that as a theme like we're seeing here. So you kind of summarize ideas in that way. What are the things that you're broadly seeing within the target that you create, and have some conversation about those themes. Like as the facilitator, you look at them and you say, I'm seeing this. Are you seeing that too? And kind of have that back and forth dialogue. And what we would typically do is take our notes about that dialogue and go back and turn that into a vision statement, because this is a lot of wonderful, important ideas. At the end of the day, you need a sentence for a vision. The point is very much around having that conversation where you're saying, these are the things that I want to see for our future, and hearing those things from multiple voices and perspectives and sectors within your community. The turning it into a vision statement is good to have that kind of place to go back to, but having that conversation where all those ideas have been kind of put out there in front of the group to reflect on and see on a piece of paper or on a computer can be a really powerful way to start out your group work together.
Changes in what color?
It is.
We're still seeing awesome ideas coming through on the chat. Thank you, everybody. And we're definitely reading those and seeing those really good ideas. Universal child care, providing support for families, especially low-income families, and vulnerable time between the end of the baby's first year and the beginning of Great Start, Head Start. So really, really good ideas and important ideas for informing the needs assessment process as well, as you begin to think about what data you want to look at and that kind of thing. So thank you for those great contributions to this conversation, and now panic can be reduced because folks participated. So thank you very much for doing that. I'm very grateful to you for that, and for the great example ideas that you came up with that would provide a really strong starting point for forming a vision. So the example, Title V vision statement, this is just another example vision statement, just to kind of get a sense of sort of the length and type of components that you might see within a vision statement. I don't think we have to read through that one, but just to have a sense of what a vision statement might look like. So we reached out to a couple communities to ask if they would be willing to share how they've come up with vision statements for their needs assessment processes. Chelsea Maxwell from Livingston was generous enough to provide a one-page overview of how they approached visioning, which is really awesome, and we're very grateful for her for doing that. We were hoping she'd be able to kind of share what they did on the call. She had to, I believe, jump off a little bit early. Chelsea, if you're still here, then please jump at any point in time. And Elaine, we saw you at the very beginning, and so if you'd like to jump in at any point as well, just let us know. You can just provide something in the chat box maybe and say, I'm here and I'm willing to share, or I can add something to the conversation. Please do jump in and do that so we can unmute your line and get your perspective on this as well, because we're Reflect was on the one-pager, but I'm sure this process involves lots of other pieces that you could share with us as well. So there will be a one-pager from Livingston that's available on the SharePoint site that you can use as a guide for your process. Within that, we just kind of pulled out a couple of pieces of that one-pager to share with you. They started with defining what a community vision is. They described it as a picture of the long-term results of the planning process, what we wish to accomplish when the developed strategies are implemented, and it illustrates what community health will look like with a successful public health system in place. So I think this is awesome language to begin the visioning conversation with your community partners. Just to say, when we say we're talking about a vision, this is what we mean. I think these are awesome talking points to begin from. They also provided some directions that illustrate what their process looked like. What they did was they had folks write down their thoughts on Post-it notes, and they had people use one Post-it note for each idea that they had. So, you know, as you were talking, we could hear that you had kind of a list. And so in their process, they would say, for each of those items on your list, record it on a separate Post-it note, so that each Post-it note includes only one idea. And the guiding questions that they use are awesome. What does a healthy community mean to you? What are important characteristics of a healthy community for all who live, work, and play here? Envision the local public health system in the next 5 to 10 years. What are some of the positives about the health status of Livingston County? What problems do you see with the health status of Livingston County, and what can we do to improve the health of Livingston County? So lots of really nice guiding questions to support in generating ideas that can be used to form a vision. So what they did with the ideas on the Post-it notes was they used them to create an affinity diagram. And we don't have their specific affinity diagram, but just in case you're not familiar with the term, we have sort of an example of what that would look like. So as you were throwing out ideas in our last target exercise, a next step we could take with those ideas is putting them into like categories. So on this example, watching folks throughout things like all women and children achieve their potential, moms, babies, and families are thriving, no years of life lost to preventable causes, no skill or talents wasted, health at every stage of life. So we're imagining that those were ideas that were thrown out throughout the process, and that the group went through the next step of saying, we think that these two ideas are alike, and we think that this idea is like this idea, and putting them into groups. Once those groups are formed, they can be titled, and that's what you see at the top. So that first group that I read through could be titled Women, Children, and Families Have Full and Healthy Lives. So the idea here is that you can create kind of those clusters of ideas that are similar to one another, name that cluster so that you are articulating what makes them hold together, and you can turn those ideas into, at the top, into your ultimate vision statement. And that's kind of the process that Livingston used as they walk through. So is there anyone from Livingston County who would like to add anything to that kind of brief overview of the process that you used, or has any pointers for the group as you jump into the visioning process? I don't need to put you on the spot, so it's okay if we're ready to move forward. Because they couldn't stay on the line the whole time, so they might not even be here anymore.
Is the other local health department that has a visioning process that they'd like to share what they did, how it worked in your community?
I'm a nice person. Come up with something.
You're on mute now, so if you have any other health department has an idea about visioning that you'd like to share.
I have nothing to share, but I'm getting a little bit confused here. When we're working for this vision, we're trying to develop a vision statement for our grant purposes, not health department vision statement. Is that correct?
The way the process is set up is for you to develop a vision statement for maternal and child health within your community. So it's not your vision statement for your health department as a whole. It's what you're envisioning for maternal child health in your community, which can be broader than what you're funding with Title V. So it's a broad statement of what you're envisioning for maternal child health in your community. That's an excellent question. Thank you for asking it.
Okay, thank you.
The other piece of this step is talking about values. So within the tool that we will share after the call today, you'll see a couple of questions to respond to about values. And this process can be completed in a similar way with your community partners. Usually this conversation's much shorter and more straightforward, where you're kind of just talking through each of these questions with your group. The questions that we're suggesting are, how do we need to interact with one another to achieve our vision? What climate will be necessary to support interacting with one another in an effective way? What are some partnership principles we want to set to ensure we're working effectively with one another to achieve our vision? So examples on the next slide of what those statements or partnership principles might look like. So you might talk as a group and say, in order to achieve this vision, we really need to remain open-minded to new ways of meeting community needs. We don't want to only what we've always done. We want to remain open-minded as a group to new ways of doing things. You might say that you want to acknowledge and work beyond interagency competition. Sometimes that can be a challenge in communities around limited sources of funding and access to clients and things like that. So that could be something that you talk about as a way to get to your vision and how you work together. You might notice that what you really want to do is be driven by what you're seeing in your data. You might talk about wanting to support full parent engagement in the process. You might talk about how you want to listen to one another's experiences and perspectives. So those types of things of how, as a group of agencies and organizations within your community, how can you most effectively work together through this process to get to the end point of this process, but more broadly to reach your vision as a group. Again, a sit-down sort of conversation with your community partners, throwing out ideas and documenting those, and getting agreement on what they're going to look like for your group. So again, Livingston County was gracious enough to share their process for coming up with values. And again, they have really nice language for articulating what community values are. They say there are fundamental principles and beliefs that will guide the MAP process, so that's the assessment process that they used. Values provide a basis for action and communication expectations through the MAP process. guiding principles that represent how the community is expected to operate. They reflect and reinforce the desired culture and behavior of the team, and that they help us to attain our vision. So really nice talking points for getting that conversation started, to be able to say, when I'm saying values, this is what I'm thinking about. This is what I'd like us to talk about. There's a similar process that they use for creating their vision statement to create their value statements, where they use sticky notes to gather responses to a set of questions, and then they organize those sticky notes into an affinity diagram. So the questions that they use take into consideration the shared vision ideas discussed previously. What are the key behaviors that will be required of the local public health system partners, the community, and others in the next 5 to 10 years to achieve the vision? What type of working environment or climate is necessary to support participants in performing the above behaviors and achieving the vision? So really nice examples of questions that could guide that conversation. So again, it was Chelsea at Livingston who was generous enough to provide this information and put together a one-page handout on how they approach this process. And Chelsea's contact information is here if you'd like some more information from her directly on the process that they used. Okay, so those are the key activities of the first part of this needs assessment process. Coming together as an internal health department team to work out your plan, inviting your community partners to participate, and then having a meeting with your community partners to articulate your vision and your values. And once you've finished that part of the process, you'll document what you found in the tool that, again, we'll provide after the webinar is over. And with our team here, and we'll provide any kind of reflections, comments, feedback that we notice as we read through. We do highlight. Okay, we are seeing some questions. I'm pausing because we're seeing some questions come through on chat, which is great. And as soon as we get to the end, we will open it up for questions, and we'll start with what's in the chat box. So thank you for posting your questions there as they come to you. There is a SharePoint website set up to document this work that we're doing together. There's a tab called Documents, and that's where we're going to put tools, resources, announcements, that kind of thing. The calendar, where you can find all the dates that are associated with the needs assessment. So you receive a document that outlines key dates, and we'll have all of that information on this calendar as well. And there's also going to be a links tab, and on that tab you'll see links to all of the webinar recordings, as well as other information that's located somewhere on the web that we think might be useful. There's a contact information button that you can use to reach us at MPHI, and we have the tiny URL and the full website link here on this slide as well. Is there anything you want to jump in and add?
The communications examples that Julia had mentioned earlier, you can find those. Those are currently in the Documents tab, as well as the one-pager that Livingston County provided. And then within the calendar resource, you will be able to see all of the dates webinars, and if you click on the date in the calendar, you can access the login information, the call-in information for that webinar as well.
So be a good resource for sharing information. If you can think of something that you think would be a great resource to share through this portal, please let us know, and we'd be happy to help get it up and get it posted. So next steps. We set a target date for completing these first 3 steps of February 6th. We do recognize that if you're working with a community group, you might have a meeting that's already set on the calendar, and that meeting might be set for February 7th. And if that's where you're at, and that's kind of the calendar that you need to work with, that's completely fine. Just reach out to us and let us know if there's a circumstance that prevents you from finishing these first 3 steps by February 6th, and we'll work with you. But we're hoping we're going to encourage you to stay on schedule as closely as you can. It can be really easy in this process to get behind and then not have sufficient time at the end to really do the good action planning that really makes this process kind of turn into action. So I want to encourage you to stay on timeline as close as you can, recognizing that there can be circumstances that make another timeline more efficient for your community. When you complete a step, you can email your submissions to Lauren, MPHI, and her web address is here. Our next webinar is scheduled for February 14th from 10 to 12, where we will go through the first of the assessments. And so with that, I'm going to open it up to questions, and we can start with what's in the chat box. Can you approaches for health departments that cover more than one county? For example, because of the nature of our communities, we must do processes for Bryan and Eaton County separately, and Eaton County is actually a part of a larger CHA-CHIP process. This would be an even bigger issue, a bigger ask for regional health departments that cover large areas. I think that Barry Eaton is an excellent example of a health department that's been super thoughtful about how to approach needs assessment in a way that reflects the diversity of the communities that they serve. And I would encourage any health department to think about needs assessment generally in that kind of way. We recognize that you have funding to complete one needs assessment process, not two. And so that could certainly pose a challenge for a district health department or a multi-county health department where you're thinking we can't really capture all of our community's diverse needs within one assessment. For communities in that sort of circumstance, I think that we'll probably have to talk individually with you about what your circumstance is, what makes really good sense to you as far as an area of focus or a way to meaningfully reflect the diversity of the communities that you're serving within your multi-county area. So if you have that concern, if you have that need, please reach out to us, and we can have that conversation kind of individually based on your sort of unique circumstances. Okay. Any other questions? You are now unmuted, so please go ahead and ask your questions over the line, or you can type them in the chat box.
I have a question. I understand that the $15,000 that we are going to be receiving is not going to be coming into our CPBC agreements until, I believe, March. It should be the second amendment. Is that correct?
The second amendment that the $15,000 will be coming to your agreement, and it has not been, I don't think it has been released yet, but it is supposed to be effective January 1st. I don't believe that it's going to be held till March. They've told us the second amendment begins January 1st, which obviously was several months ago.
Right. I don't believe it's been released at this point either. But
yeah, unfortunately, we do not have control, ability, anything related to when they release the amendment. So we are at the mercy of our Budget and Contracts Office. But it's my understanding that they'll be paying from January 1st.
And what sort of requirements do you have as far as submitting our plan for the use of those dollars?
There's an email that was sent out in mid-December, I think it was on December 15th, and it gave a template of an MCH work plan. And so you can use the work plan as it is, or you can modify it to meet the very specific needs that you have in your community. Instead of asking you to resubmit your entire local MCH plan, since everybody is doing this process, we are asking you to submit that work plan for the MCH needs assessment. The MCH needs assessment is part of the local MCH dollars with this one-time additional funding. It's part of the local MCH plan. It will be housed in the project called Public Health Functions and Infrastructure. Some already have that project open because you're using your other MCH funds for that project. And if that's the case, we'll just have it opened with the Second Amendment and add that additional $15,000. Some of you have not had that project open because you didn't have projects in that or activities in that particular project. And if that is the case, then we asked for a new project to be open, and you can attach your work plan there. So if you did receive your work plan, please let Robin and Trudy know, and we'll be happy to send it to you again. And if you've got any questions about how that works, just let us know. We're hoping that it will be very minimal work on your end. We tried to put a lot of thought into how the work plan was so that you could literally put your health department's name on it and load it into eGrams with the second amendment with the $15,000 that's been added. And that your finance person can just attach that right onto the LMCH source of funds line.
Okay.
We have a question in the chat about accessing the slides from the presentation. Those will also be posted on the SharePoint site. Sorry, I forgot to indicate that, and we put the URL back up so you can see where that site is located.
Trudy, I also sent the tiny URL to health officers and to the people that I know that have told me they're doing MCH needs assessment, and to all the people who are contact people for the local MCH plans. So the tiny URL was sent out to people as well in December.
From Livingston also shared that you can find the publications from their MAP needs assessment process are on their website, ICHD.org, under publications. Of course. LCHD.org under publications. See more information about the really great work they've done out in Livingston County on needs assessment. Another question that came through is, when is the template due? The way that we're approaching turning in the template in the same way that we're approaching kind of the process in general. So we have the first 3 steps of the template that we'll be sending after this call that will be due on February 6th. And then the deadlines will follow. They'll be posted on the calendar. You can find all the deadlines for when each of the sections of the template are due on the calendar itself. And again, if you have unique circumstances that make it not feasible, not efficient to stay right with that timeline, just contact us and let us know so we can work with you on coming up with an alternate deadline. Again, our main goal is to set deadlines so that we're moving the process along, not kind of waiting too long on any particular piece so you can't move forward.
You might remember that we sent out an email with the MCH work plan, and also attached to that work plan was the schedule, and I had to resend the email because I sent the wrong copy of the schedule. So the schedule that has the webinar date and time and the due date were also on that schedule as well.
What do you question about when the work plan is due?
The work is due at the time that your finance person submits the second amendment. So whenever the second amendment is released, agencies have up to 3 weeks to complete the second amendment. So in 3 weeks of the amendment release date, which unfortunately we don't know when it was to be in December, so any day.
That would be unrealistic for some departments to turn that around that quickly, as none of those would need governmental approval.
We understand that may be an issue for some health departments. I'm just sharing the guidance that we've been given from budgets and contracts.
Okay.
What other questions do you have this afternoon?
To the Second Amendment again for a moment. Now, you say you're not, and I understand you're not quite sure when that's going to be released, but I believe you're assuring us today that the deliverables within that amendment are not going to change from what we've been discussing today as far as a template and plan. Is that correct?
Yes.
Okay, thank you.
Okay, Having a question about the distinction between the work plan and the template, with some folks not having had a chance to see the work plan piece of it yet. I know you haven't seen the template piece of it yet either. So the template is where you will document each piece of the needs assessment process as you go through it. So as you complete visioning, that's where you will document your vision. As you complete the assessments, that's where you'll document your findings. The work plan is sort of overall what you're planning to use these funds for, and Trudy has a template that she sent out for that piece of it. So you'll be receiving the template of the needs assessment tool, the first 3 steps of it, from LMCH, and you can reach out to Trudy to get a copy of the work plan. Is that correct?
That's correct. The work plan is really just the local maternal child health plan everybody had to submit. Each year we had agencies had to do work plans for each performance measure that they selected. So theoretically, this work plan is for a local performance measure on MCH needs assessment. We felt like it was a lot of work to have to resubmit the entire local MCH plan again, so we tried to simplify the process and only require the work plan component and not have you resubmit and attach it to your original local MCH plan. We know that it belongs with the local MCH plan, and so we're sort of electronically doing that or mindfully doing that, trying to simplify the process. It's confusing. We were trying to make it simple.
The plan itself is largely completed, right? Yeah. So the work plan is done, unless you want to revise it to reflect something specific you're doing around MCH assessment in your local community.
Okay, this is Fraley. I'm really getting confused. So now I thought what you had emailed out to us that we could just put our name in. I thought that was a template, but now I think that's the work plan, right?
The work plan has two pages. One page is the work plan, and the first page is the contact page, so that you can add a place for who your local MCH, the needs assessment lead is, particularly if it's somebody different than is on the local MCH plan. So what I emailed out has a cover page and a work plan.
Okay. So,
does that make sense?
So that's what you emailed out. And so now the document that was referenced in these slides, that's what's called the template now?
So there's 2 things. One is the one that you just talked about. I said there's a cover page and a work plan. So that's the piece that needs to be electronically uploaded on eGrams. Other piece, I guess we use the word template twice.
We'll stop using the word template altogether and just go with tool.
Yeah, the other piece is the MCH assessment tool. And so you'll be receiving a copy of part of the tool, the steps 1 through 3, at the end of this webinar. It will be posted on the share point, and I can also send out a group email to people with that as well. I can send out all things again. It might be helpful to have links like from the CDC in an email. So we will do that to help simplify things. So we'll give you lots of ways to access information. I don't overlook people.
Okay, thank you.
We have adding context to the distribution list.
We would like to add more people to the distribution list to get the MCH information. People let me know, I add them to a distribution list called MCH Needs Assessment. So if I already have a low MCH contact list, a health office list, and a finance list. So I make sure that I an email box, but I would like to add whoever you want to have it distributed to, just send it to our mailbox, the MDHS-maternal-child-health@michigan.gov. Or my email and you want to send it to me, @michigan.gov, I'll add it that way too.
We'll write in the slide here.
It has to do with what's the long-term goal of this project. It is to conduct a needs assessment, and it's the expectation that as a basis or as a result of this needs assessment, we'll naturally then find the projects that we're supposed to be funding in our 2018 LMCH plan.
Will only be the hope and the gold standard for fiscal 18 and 19. That this will really help to inform your future LMCH needs and goals, certainly. It also, in a larger sense, helps us as we have to do our Title V big needs assessment every 5 years. We're in year 2 of the cycle, and this has given us an opportunity to really look to the future about in 3 more years, what our local health department saying are their needs, so that we can really help inform what then the overall state needs are. So while we've certainly asked for consumer and partner input in the past, we have not been able to do gather information to this magnitude, I don't think, ever before. So it's really exciting for us to be able to take the information that you're getting and to really bring that forward in our state needs assessment.
Thank you, Trudy. Any other questions this afternoon? Okay, I'm not seeing any come through on chat, and I'm not hearing any additional questions over the phone. So I think we will wrap up for today. If any questions occur to you after the fact, please reach out to us, ask your questions. I know that as you jump into this process, things that seem clear initially can get confusing as you get going, and that is absolutely what we're here for. Reach out to us between webinars, and we are more than happy to answer any questions and provide any support that we can as you jump into this process. And I will tell you that we are so looking forward to, in a little over a month, seeing what you've done and seeing what you've articulated as your vision and values for your community and who you've engaged in this process and all of those pieces. So thank you for participation again today, and again, don't hesitate to reach out. Any other closing comments for today from the group?
I'd like to reemphasize that if you're having any kind of struggles or you're not sure how to move forward, as Julia has already said, please reach out to us. That's what we're here for. We're really excited about this process, and we're really excited to be working with you as we move forward. Thanks for joining us.
So have a great afternoon.